think this is the first time we were able to have a full press conference with everybody since last March. So it's wonderful to see all of you. Thank you for joining us today on this beautiful day in the state of Maryland. With me today are two folks that are no strangers to you. You've seen them a lot over the past few months, but two of our great team leaders, our Health Secretary Dennis Schrader and Dr. Jinlene Chan, who's done such a great job as our Deputy Secretary of Public Health. It has been 1 year, 3 months, and 10 days since we confirmed the first cases of COVID-19 and declared a state of emergency in the state of Maryland. Every single day since that day, last March, together we have faced immense and unprecedented challenges. And throughout this long, hard-fought battle against the worst global pandemic in more than a century, not a single day has gone by that I haven't been inspired by the will, the strength, and the resilience of the people of Maryland. We've been through so much over the past 15 months, but just look at how far we've come together to reach this hopeful point. We opened closed hospitals, built field hospitals, and expanded our hospital surge capacity by 6,000 beds. We procured tens of millions of units of PPE and deployed thousands of contact tracers across the state. We built an entire testing infrastructure from scratch, going from just 50 COVID tests per day to now surpassing 10,600,000 COVID-19 tests. We built a massive vaccine infrastructure from scratch, deploying a team of more than 11,400 people and opening over 3,000 points of distribution to provide every single eligible Marylander with access to vaccines. The state of Maryland has now administered more than 6.5 million COVID-19 vaccines, not only meeting but exceeding our goal of reaching 70% of all adults vaccinated by Memorial Day. More than 72% of all Marylanders 18 years and older, and nearly 90% of all Marylanders over the age of 65 have been vaccinated. That's a faster rate than the nation and faster than most other states in the country. And as the number of vaccinated Marylanders continues to grow, the number of infections continues to fall. Every day now, we are seeing amazing declines in all of our health metrics across the board and across the state. In January, our positivity rate was just under 6%, and today it's under 1% at 0.82, the lowest since the pandemic began and lower than 43 other states. In January, our case rate per 100,000 was 53.39, and today it's down to 1.57, the lowest since the very first days of the pandemic and the second lowest in America. In January, COVID hospitalizations in the state reached nearly 2,000, and today hospitalizations are again below 200, the lowest level since March of 2020. With all of this amazing progress, and thanks in large part to the hard work, the sacrifices, and the vigilance of the people of Maryland, we have finally reached the light at the end of that long tunnel. Today, I am announcing the end of the COVID-19 state of emergency in Maryland. On Thursday, July 1st, any and all emergency restrictions and mandates of any kind will end. Masks or face coverings will not be required in any settings, anywhere, including schools, camps, and child care facilities. Businesses and other workplaces are obviously still able to set their own policies and will support their ability to do so, but there will not be any legal mandate from the state for wearing masks at any location, anywhere in the state. July 1st will also begin a 45-day grace period through August 15th, where certain regulations will continue to be relaxed to help people complete the transition out of the pandemic. This includes an additional 45 days to renew your expired driver's license. And if you have not yet made an appointment to do that, you should take care of that as soon as possible. We're also granting an additional extension of the moratorium on evictions related to COVID-19 through August 15th. And health officials will have that 45-day period to transition from emergency operations. While the end of the state of emergency is an important step in our recovery from COVID-19, it does not mean that this virus and the variants no longer pose any threat. If you have been vaccinated, you are safe. But those who have not gotten vaccinated will continue to be at risk. At this point, there's simply no excuse for not getting vaccinated. The vaccines are safe, they're effective, and they're readily available everywhere. Our GoVax summer tour will be continuing. This weekend, Father's Day weekend, we are partnering with the Orioles and Major League Baseball to hold vaccination clinics at Camden Yards. Everyone who gets vaccinated will receive 2 free lower-level O's tickets. We have also reached the midway point of our $2 million Vax Cash lottery promotion. 22 people have already won $40,000 each, and you still have your chance. Once again, any Maryland resident age 18 and older is automatically eligible to win $40,000 each day, and then has a shot at the grand prize of $400,000, which will be chosen on the 4th of July. Throughout last winter, when we were still in the thick of our fight against this deadly virus, I would often remind Marylanders how much we were all looking forward to the day when we could take off and throw away our masks, when we could get all our children back into school, and when we could go out for a big celebration at a crowded restaurant or bar with our family and friends. I said then that getting our state vaccinated was the only way to get us back to that sense of normalcy. As they have time and time again throughout this crisis, Marylanders rose to that challenge. Now we are gathering with loved ones to celebrate birthdays and graduations. We're spending time with and hugging grandparents, having nights out with friends at local bars and restaurants. We're going to ball games, and we're getting back to work with 12 consecutive months of job growth and one of the best economic recoveries in America. It is truly a time for celebration. But I ask that you take a moment to remember those 9,472 lives that we lost, and that we give thanks for the healthcare heroes who saved so many other lives, and the citizen soldiers of the Maryland National Guard who answered the call. And remember more than anything that each and every one of you, your actions has made this day possible. I'm so proud of our state, and I'm grateful to have had this honor to serve as your governor. I thank you all for being Maryland strong. With that, we'd be happy to take a few questions. It does not impact our access to federal funds. Well, again, I want to make sure that I stress that it's not mission accomplished. The battle's not over. We're transitioning from a state of emergency to an ongoing operation. And I can tell you that our hospital our health care, our health department. Everybody's going to continue to try to wind this down over the next several months, and our efforts continue. But it is a very hopeful point, and you know, the 15 months and 10 days, I can tell you it's been our primary focus every single day, all day, in all of government approach to tackling this crisis. And it's great to be able to at least move it into now an important operation rather than the thing that consumes, you know, all of our time and effort. But just take my hat off to all the people on our team and the governor's office, at the Department of Health, National Guard, MEMA, every single one of our folks all across state government, our local partners, private sector, and all the people that stepped up. It is an incredible day, and there were days when I wasn't sure we'd ever get here. So it's why you sensed a little emotion. Happy to be at this point. Yeah, we're very good in almost every statistic. I said we have the second lowest. We're second lowest in America on cases per 100,000. I think we have the fourth lowest positivity rate. We're the seventh best in a couple of other categories, and so we're in the top 10, I believe, in every point of measurement, and so I'm very pleased with that. We're also on number of people vaccinated. I think we're fourth highest in the country, and I think that has a lot to do with all the other metrics. You know, there are some states, I know that the federal government is now saying they may not reach their goal of 70% receiving a first vaccine by July 4th. We reached it in May. I know there are a bunch of states that aren't even going to get close to that, and some of which are at 50%. So, you know, our team did an amazing job, and the people of Maryland took it a lot more seriously than some other folks. I'm sorry, Pam. I'm coming right back to you. Pam.
Thank you. Two quick questions. One, does the catastrophic health emergency still exist? And what about local governments that may want to have their own more restrictive orders like masks? Do they still have those?
The catastrophic health emergency does not exist, and certain county governments may have some of their own authorities. I'm not an expert on that. Some will not. Well, maybe I'll let Dr. Chan talk about that, but absolutely. I mean, the things that we've gone through and set up, we're already having in our discussions talk about how our existing infrastructure is going to help us with booster shots if they're necessary in the fall, and our flu vaccine effort, which is going to be more critical than ever. We're expecting a really bad flu season because last year everybody was wearing masks, so that both COVID and the flu didn't get transmitted, and I think after a 2-year gap, it's coming back with a vengeance, right? But I'll let Dr. Chan talk about it.
Yes, absolutely. I mean, as the governor indicated, all of the infrastructure that we've built up with pharmacies, with local providers, local health departments, hospitals, and others will absolutely serve not only for boosters, but also for our flu vaccine campaign, which is planned for the fall.
Are you able at this point to say that the new hospitalizations and new cases are unvaccinated people? What percentage?
We're looking very closely at that. You know, when we were looking at some of the numbers even in May, the vast majority of the people who were getting admitted to hospitals were unvaccinated, in the range of 80% or so. So we're taking a closer look at that, though.
So matching the effectiveness of the vaccine?
Correct, correct. I mean, that's what we continue to say, is that vaccines are effective, and that even though our hospitalization rates are low, I think today we had about 65 people in an ICU bed around Maryland. The people who are getting sick, and certainly the sickest, are those primarily who remain unvaccinated. So we encourage everyone to get vaccinated.
Okay.
Off topic, I'm curious what your reaction is to the video of police officers.
Well, it was a disturbing video. I watched it yesterday as soon as it kind of was hitting the atmosphere. We reached out, had conversations with both the mayor of Ocean City and our state police have reached out to the Ocean City Police, and I believe that we're just anxious to get the initial investigation conducted so we can have all the facts before making any further statements about it.